Guys, after subscribing to this channel, please make sure that you also press the bell icon so that no notification, no new video of mine, any educational video, is missed by anybody.
Hello and welcome, dear students. A lot of you had asked me, this question, this doubt on, what is the difference between pre-implantation genetic diagnosis and pre-implantation genetic testing. So I have personally replied to a lot of you on WhatsApp, on Telegram, in the app, also in chats. But since there were so many queries, I thought I'll just, finish it off by taking a class on it. And here I'd like to announce that a lot of you have requested me a class on prenatal genetic diagnosis. So there are so many tests, analyte screening, fish, you've got your NIPT, which is there, and CVS and so on and so forth. So what is the funda, what is the basis, and how do we go about doing it? So I'll be taking up a class very soon. That will be announced in my app. Those of you who have not downloaded the app, then they can go and download my app. It's available on Google Play Store, and you can always contact me on the number flashing on the screen. And I'll tell you the link. I'll give you the link, and you can go and download the app. A lot of announcements are being made on my app as we speak, and a lot of things are being added every day. So even the practical discussions, they are added on. The newer answer bank, that is added on. So June session is already latest added on my solved answer bank. Those of you who want the solved answer bank can go and purchase it. It's complete now, and as soon as the June session will be over, that will also be the December session will be over, that will also be added pretty soon. So just watch out for the updates on the app, is very important, because any new class which I'll be taking, it will be there on the app, and after followed by the class you'll be getting a the PPT from the class itself, whatever we had discussed, so that thing gets re-embossed in your mind. See, these classes will be of no use if you're not getting benefit out of it. If you're not able to remember, recollect, and then reproduce those things in exam, my efforts will be in waste. So I really want my students to get as much as possible through all these classes which I'm taking. And if there is any doubt, I repeat, if there is any doubt regarding anything, please feel free to approach me. I have answered you at 2 a.m. in the morning. I have answered you at 7 a.m. in the morning. There is no time, where I will not reach out. Yes, when of course, if you question me when I'm in the hospital, I'll come back and answer you. So please do not hesitate in asking the questions, but just make sure that you ask them in the WhatsApp, because sometimes during with Telegram and with the chats in the chat in the app, the message tends to get lost. So it's always good to just approach me through WhatsApp. It's just easier. A lot of announcements are being made on the chat, so that is the reason why they get lost. We tend to give you personalized messages so that nobody gets to miss on anything new and upcoming which has come on my app, and which is why sometimes the messages get lost if you have tried to contact me. Anyways, let's not just waste any further time. This, whatever I've written, is just the basics of what I'll be teaching to you in my class. It's the class is about the difference between pre-implantation genetic diagnosis and pre-implantation genetic screening, PGD and PGS. So sometimes the question is asked about PGD, sometimes the question is asked about PGS, and sometimes you just write down whatever comes into your mind regarding something that you have studied about pre-implantation diagnosis. Just that. That will also fetch you marks. It's always better than not writing down anything. Like I always say, write down something, whatever comes into your mind. Just draw a few figures so that examiner feels that you at least tried, you know something about this topic, and they might be lenient enough to give you a couple of marks over there, and that is also fine. Anyway, so coming back to the topic, pre-implantation genetic, let's say, testing. What exactly is it? Why do you want to go for it? Just imagine a patient, and first of all, most important thing, it's restricted only in the IVF setting. So anybody, for example, is a candidate with, for example, a patient with a very high maternal age, towards in 40s, okay, and if she wants to reproduce, first of all, her reproductive, this thing, for the fertility score has already gone down, so she might as well need IVF itself. But just to make sure that whatever offspring now she is having, harboring in the uterus, is healthy or not, the only way to go by it is through this channel. And that's not only restricted to the females with an advanced maternal age. That's got so many indications which we'll get to later. So what I'm trying to say is, what is the idea behind this pre-implantation genetic testing? Today we are going to talk about pre pre-implantation genetic testing. The class that I'm taking is on prenatal diagnosis. Don't confuse them. There are many ways for prenatal diagnosis, but as far as pre-implantation technique is concerned, that's only possible through IVF, because the procedure, as you can see on the board, is only through testing the embryo. And how do you have an embryo in your hand is only through IVF, right? So let's not get there. Let's just come back to just pre-implantation genetic testing. All right, I've not specified diagnosis or screening. So, like I said, why do you need is the basis. So you want to be sure that whichever fetus you are carrying is healthy. You don't want to take any chance. And who are those substrata of patients who will say something like that? Then I don't want to take any chance. I want a healthy offspring. First of all, those couples who have a fear of an abnormal child. So that means those patients who've got a history of two or more children with congenital abnormalities. Maybe consanguineous couples who one of them is a carrier of some autosomal recessive disease or an X-linked disease. They know that maybe they've had repeated abortions, recurrent pregnancy losses. These are all indications of pre-implantation genetic testing. This is divided into two categories. That means those couples who are going through an IVF procedure will not go for this testing. Only the ones who are fearing or the ones who are having some problem will only go. No, it is also screening for those couples who are going through IVF but still they want to be sure. Okay, that is how the difference starts between pre-implantation diagnosis and screening. So those couples who have been harboring diseases, now listen to this very carefully because this is the difference. Those couples who've had or who are harboring some disease, some chromosomal abnormality, when they undergo this testing, that is called as pre-implantation genetic diagnosis. I want to diagnose whether this fetus, whether this embryo is having that disease or not. So that means those couples who've got some family history of X-linked disorders, or the couples with some chromosomal abnormality, maybe a balanced translocation, maybe a reciprocal translocation, those couples are, and they've had maybe 2 or 3 abortions before, maybe they are going for this diagnosis. This is diagnosis. That means the couples know that they have this problem. There was a patient who came to me who had 2-3 abortions. Then she went in for testing, and she got a balanced translocation, and she was asking me, now ma'am, what to do? I already have, every time I conceive I abort. What to do now? So her answer will be this, that you go through IVF, you get a pre-implantation genetic diagnosis, and then if the baby is okay, the embryo is okay, ask them to transfer the embryo. So such couples with chromosomal translocations or carriers of autosomal recessive disease, carriers of autosomal dominant disease. That means these are the patients who know that they have some abnormality. When they undergo pre-implantation genetic testing, that's called pre-implantation genetic diagnosis. And when those couples who are just, presumably healthy, but just scared for an offspring, they want to be sure that I get a healthy baby, when they undergo it, this kind of testing, that's called as pre-implantation genetic screening. For example, those patients with advanced maternal age, they don't have any chromosomal abnormality per se, but advanced maternal age, or male factor infertility, or patients with recurrent pregnancy losses, or patients with repeated IVF failures. They've had IVF, they did not get this implantation testing. So now they will go in for a implantation testing, and then transfer only those embryos which are healthy genetically. Correct? Later on, whatever they might have, there are many diseases that are multifactorial. So genetically they are okay, they'll be transferred. So this is the difference between pre-implantation genetic diagnosis and pre-implantation genetic screening. I hope you understood that. Now, just a little tour through this. What exactly do we do? So what do we do is basically, this is the egg, this is the, the sperm. Of course, this is ICSI going on over here. Finally, an embryo is formed and a polar body is extruded. So polar body biopsy is one method. Cleavage cell biopsy is the other method. And blastocyst biopsy is another method at the stage of, let's say, dividing embryo. through which we can do this genetic testing. And mind you, this is very fast. The procedure is very fast. Sometimes the result comes in 24 hours. So you still have a day or two to implant the embryo. So that cycle is not wasted. This is also very, very, very important here, you know. So genetic testing takes, you know, sometimes 7 days, sometimes 14 days. Why? Because these are the ones who got priority. Okay, you know that the cycle has to be utilized. You'll give the results as soon as possible, right? If you do not give the this test as fast as possible, I'll be losing this cycle. It's an IVF cycle. I cannot tend to lose it. So they are the priority candidates for doing this genetic testing, which is why the other candidates, they get their results late, 7 days, 14 days, whatever. So we have two kind of tests through which these people go through, or these embryo they go through. One is the PCR testing and one is the FISH testing. I'll be taking in detail what exactly and why do we do PCR and FISH tests, what is the basis and what is the principle and so on. But PCR is good in detecting single gene defects, okay? PCR is good in detecting single gene defects. FISH is good in detecting aneuploidies. You know what are aneuploidies? Less number of chromosomes, more number of chromosomes. These are aneuploidies, the number of the chromosome. Chromosomal abnormality, deletions, duplications, and sex or X-linked diseases, FISH is better. Single gene defects, they are recognized better by PCR technology, whether it be autosomal dominant or autosomal recessive, or in case of male factor infertility. So this is just a nutshell of one of the aspects of the class which I'll be taking on again very soon, and that will be announced on my app, so just watch out.